Every year, 85,000 people in the United States have heart attacks, according to health experts at the CDC. The scary thing is that heart attacks can happen anywhere, while you're driving, at work, shopping, or at home. What if you're alone when it happens? Every minute is important when you're having a heart attack, and what you do in those moments could save your life. In this guide, we'll show you easy, practical steps you can take to help yourself if you're alone during a heart attack. Heart problems are very serious. In fact, they cause more deaths worldwide than anything else. In the United States, 1 out of every 5 people who die does so because of heart disease. A heart attack happens when blood can't flow to your heart, usually because a blood clot is blocking the way. When your heart doesn't get oxygen, its muscles start to die quickly. That's why acting fast is so important. While it's best to have someone help you during a heart attack, that's not always possible. Heart attacks don't wait for convenient times or places. They can happen when you're all by yourself. So knowing what to do is very important. Number 1, recognize the symptoms immediately. If you think you might be having a heart attack, know what to look for. The main sign is often pain or pressure in your chest that lasts longer than a few minutes. There are other signs too. Your chest pain might spread to your left arm, back, neck, jaw, or stomach. You might find it hard to breathe, even when resting. You could feel cold and sweaty, dizzy, or sick to your stomach. Some people feel very weak or like they might faint. You might feel very worried for no clear reason. Your skin might look pale or gray, and you might feel like something very bad is about to happen. In the US, about 200,000 people have another heart attack after already having one before. Don't ignore even mild signs. The sooner you admit something might be wrong, the faster you can get help. Number 2, call emergency services immediately. If you think you're having a heart attack, call 911 right now, even if you're alone. Tell them clearly, "I think I'm having a heart attack," and tell them where you are. Use your phone's speaker if you can, so you can keep your hands free. Don't try to drive to the hospital. You could pass out while driving and crash. Getting help quickly is very important since waiting can hurt your heart more. Number 3, rest in a good position. Find a safe place to sit or lie down. Put some pillows behind your back or lean against a wall so your upper body is raised a bit. This makes it easier to breathe and helps your heart not work as hard. Number 4, take aspirin if you can. If you have aspirin and your doctor has said it's okay to use it, chew 1 regular aspirin, about 300 ml. Chewing helps it work faster. Don't take aspirin if you're allergic to it. Don't waste time looking for aspirin if it's not nearby. Getting emergency help is more important. If someone else is with you, ask them to bring the aspirin to you instead of getting up to look for it. Keep in mind that aspirin isn't a treatment for the heart attack. It just helps prevent blood clots from getting bigger. Even after taking aspirin, you still need emergency medical care right away. If you're not sure whether you should take aspirin, just wait for the paramedics who can make that decision. Number 5, stay as calm as you can. Even though it's scary, try to stay calm since panic makes your heart work harder. Take slow, deep breaths. Breathe in through your nose for 3 counts, then out through your mouth. You can also try focusing on something in the room or thinking of a peaceful word to help you relax. This helps your heart not have to work as hard. If possible, try to keep your mind busy by counting your breaths or listening to the sounds around you. Remember that help is on the way, and many people survive heart attacks when they get quick medical care. If you start feeling more anxious, go back to focusing on your breathing. This is something you can control. Try to keep your jaw and shoulders relaxed, as tension in these areas can make breathing harder. Number 6, don't move unless you have to. Stay as still as you can. Don't try to get things from far away or go upstairs. Your heart is already working hard, and any extra movement makes it work even harder. Just rest and wait for help to arrive. If you're in an unsafe place like the shower or outside, move very slowly to a safer spot nearby. Remember, the most important thing is to save your energy and not make your heart work more than it has to. Try to stay in one position and let the emergency team come to you. Even small movements, like reaching for things or trying to walk around, can put extra stress on your weak heart. If you absolutely must move, do it very slowly and carefully. Number 7, make your clothes looser. Take off or loosen any tight clothes that might make it hard to breathe or affect your blood flow. This includes things like ties, shirt collars, belts, and tight bras. Having loose clothes helps you breathe better and lets your blood flow more easily. This simple step can make you feel less like you're suffocating and help you stay calmer. When your clothes are loose, your body gets more oxygen and you feel more comfortable. Even something as simple as unbuttoning your shirt collar can make breathing easier. Number 8, don't eat or drink. Don't put any food or drinks in your mouth while waiting for help, even if you feel thirsty. If you start feeling sick or throw up, having food or water in your mouth could make you choke. Just focus on staying awake, breathing steadily, and waiting for the ambulance. Even a small sip of water isn't worth the risk right now. Let the medical team decide what's safe for you to have when they arrive. Remember that your body is already working hard. Don't give it extra work by trying to eat or drink. Number 9, monitor your symptoms and stay alert. Try to notice if your symptoms are changing. Is the pain getting worse or moving to different places? Are any parts of your body feeling numb? These details will help the doctors when they come. If you feel like you might pass out, try to lie down so you won't fall and hurt yourself. Keep your mind alert if you can, but don't worry if you can't remember everything. The main thing is staying safe until help arrives. Pay attention to any new feelings or changes in your chest pain, breathing, or other symptoms. This information can be very helpful for the medical team. Number 10, protect your heart going forward. After you recover, take steps to prevent another heart attack. Talk to your doctor about your risks from things like high blood pressure, high cholesterol, diabetes, smoking, not exercising, or being overweight. Keep your phone charged and know the fastest way to nearby hospitals. Tell your family and friends about your health so they can help in emergencies. Have any medicines your doctor recommends in easy-to-reach places. Make healthy changes like eating better, exercising regularly, drinking less alcohol, and quitting smoking. Small changes in how you live can make a big difference in keeping your heart healthy. Regular checkups with your doctor are also very important. Consider joining a heart health support group where you can learn from others who've had similar experiences. Think about getting a medical alert device or bracelet that can quickly tell emergency workers about your heart condition.